The professionals at Eye Care Associates have been the leaders in our valley when dealing with corrective eye care. In fact, they introduced the first laser here in 1978. This technology is changing almost daily, and the eye care surgeons are still setting the standard of care in their laser center. Before we speak to our doctor, let's hear firsthand from a patient who has gone through the procedure.
I've had glasses since I was in first grade. I needed my glasses for everything. From getting out of bed to looking across the room at the time on the alarm clock, to work, to driving. I couldn't take my glasses off. If I didn't have them, I could not see. If you were in front of me, you would be all blurry without my glasses on. So I decided that my mom had it done years ago, and I thought, I'd like to try it. I was reluctant at first, but I'm glad I did it. How I see now, oh my. The first time I could see perfect, I got off the bed and I could see the clock across the room in the surgery room. And I'm like, oh my gosh, I can see what time it is without my glasses on. My vision just kept improving every day. Now driving down the road, further to distance, I can see the signs, I can read them, even better than when I had my glasses on. So everything, it's the best thing I've done. I absolutely love it.
We're joined again by Dr. Erzurum, who will take us through the basics of laser eye surgery. First of all, can you tell us the difference between a nearsighted eye and a farsighted eye?
Yeah, I guess that's a pretty basic question, but a lot of patients are confused about which prescription they have. A nearsighted eye means that you can see things easier up close than you can in the distance. To us as ophthalmologists, it means that your eye is actually larger than the average eye, or your cornea is too steep or steeper than the average eye. A farsighted eye is just the opposite. It's someone who has difficulty seeing more up close than they do in the distance, and their eye is slightly shorter or their corneas are a little flatter.
And another word we hear, what about astigmatism?
Astigmatism often accompanies nearsightedness or farsightedness, and it is an irregularity in the shape of the cornea that causes us to see shadows around letters or images. And it requires an additional correction in your glasses or laser treatment in order to correct.
So now that we know the differences, which type of eye represents the best candidate for laser eye surgery?
At this point, just about any eye is a good candidate. The laser actually treats farsightedness very well, as it does nearsightedness, and it has a fairly high range on the correction for astigmatism.
And at what age does someone become a candidate for this surgery?
Typically, we don't suggest laser refractive surgery for someone until they're about the age of 21, and you want to have at least 2 years of stability. If you've already started to develop cataracts, we would discourage you from thinking about doing laser surgery as well.
And I understand there's different types of laser vision correction.
There is.
Can you give us a rundown of those?
All of them are done with the same laser. They're all done with an excimer laser. But there are different ways of getting the laser treatment to the cornea. There is LASIK, which actually creates a thin layer in the cornea, and by elevating that layer, we then do the laser treatment and replace that top flap on the cornea. The alternate procedure is what we call epi-LASIK, where we actually perform the procedure right on the surface of the cornea, and there's no incisions made in the eye, and both are very successful at changing the curvature of the cornea.
Well, let's take a look at that procedure now.
First, a corneal flap is created and folded to the side. LASIK involves removing corneal tissue under the LASIK flap to correct the focusing power of the cornea. How much corneal tissue is removed and the length of the laser treatment depends on the amount of correction needed. Treatment times can range from only seconds to a minute or so. The flap is then returned to its original position where it bonds without the need for sutures. Epi-LASIK is different from other forms of advanced surface treatment in that it actually uses a special instrument called an epikeratome to make the hinged epithelial flap. Next, the precise amount of corneal tissue is removed to correct the focusing power of the cornea. How much corneal tissue is removed and the length of the laser treatment depends on the amount of correction needed. Treatment times can range from only seconds to a minute or so. After treatment, if the epithelium flap was not completely removed, it is placed back over the treated area and will ultimately be replaced as new epithelium regenerates.